Hello and Assalamu alaikum. My name is Asad Rehman and I'm a gastroenterologist at Cleveland Clinic. I am part of the APPNA YPC for this year, and it gives me great pleasure to give you an overview for the intern year for those of our fellow physicians now who are going to join their intern year beginning in July of this year. Um, Last year in 2023, there was a phenomenal boot camp video that was done by the APPNA St. Louis chapter. So I do not want to be redundant, and I would highly encourage you to watch that video as well as a prelude to this talk, because I think that covers a lot of topics that are very important. And I will probably be highlighting things that probably more pertinent compared to last year, and maybe add as a supplement to that year's video. So first of all, congratulations. I think this is a tremendous achievement for all of our, residents who are going to join this year. I think this culminates a very long journey for you all. And I think before you even begin that, take a moment to think back and look back at the journey that really wasn't yours alone. It was actually, your family's journey along with you, your friends, your support groups, and all that. So I think take a moment to pat yourselves on the back before you embark on this new challenge. So this conversation that we'll be having, and we'll have a Q&A session afterwards with our panelists. But this talk is going to focus on your orientation that you guys will have in June before residency begins on July 1. I'll go over what an average day may look like for you, taking an example for internal medicine residency, but things may be similar for other specialties as well. I'll talk a little bit about professionalism, talk about documentation and how that is very, very important in today's day and age. Another thing that I think what you all should be knowing about is how to take feedback, especially because you'll be part of 360 degrees feedback with yourself, with your mentors, with your attendings, as well as with your students as well. It's important that during this journey, don't just focus on the day ahead. Think of the big picture as well about what this is going to do for you and your career moving forward. And this is a very important time in your life for the next 3 years for internal medicine, 5 years for general surgery, and so on and so forth for other specialties. But I think it's important to realize that it is not just a sprint; it's a marathon, and you have to have resilient strategies to prevent burnout along the way. So in terms of your orientation, we're currently, while I'm recording this talk, this is April. I think all of you who have currently matched are now well into your pre-orientation, emails that are being sent back and forth between you and your coordinator. So it's important that, you get into the habit, if you already don't have the habit, to check your emails periodically. Make sure that, whenever is asked, whatever is asked from you, from your coordinators, you really communicate back and forth with them. I think you should be clear in your communication. If you have any questions, you can ask them. You can ask your other, colleagues who are going to be in the same program as you, especially regarding how to obtain licensure, how to apply for, your NPI number, PCOS, DA, all that stuff. So it's very, very important to, be in close communication with them, whatever is needed for your J1 visas or H1 visas, to make sure that everything is done on a timely basis. I hope that all of you will be able to join your programs on time. Many programs they do offer, some kind of a social event or a before the residency begins on July 1 to really meet you. And if they do offer that, try to attend those. I know sometimes some of us may not be that extrovert, but I think it's important to meet people that are going to be with you, meet your program coordinators, meet your attendings, and get to know them better. I think the people, once you get to know them, you'll realize that's the journey along the way will be much easier. So it's important to attend those social events. For those of you who require visas, when you come into the United States, you'll be required to have a social security number, and you'll be able to apply for that. Once you have spent about 10 days in the United States, and it's an important document that you will be needing when you will be applying for your credit cards. It's an important number that you will require. So I think it's so make sure that you track the number of days that you've been in the US and apply for it as soon as possible. Um, For those of you who will be joining programs that require commuting back and forth from work, especially if it's not a walkable distance, you may require, a driving license and a car. You may have an international driving license, but I think it's important to get a driver's license early on as well. Look at the state where you'll be moving to. Many states have a learner's permit, and for that you may have to do a test, which sometimes is a multiple choice question test. Here in Florida, you required to get about out of the 50 MCQs, you probably require about 40 to basically be able to get a learner's license. So, and all that information, all that material that is required to prep for that learner's license is available online. So look that up, and if it's possible, so that when you come in, you can quickly get a learner's license as soon as possible. And then, when you'll be coming in as part of your orientation, you'll be required to, shadow residents. You'll be seeing them going around in the wards or the ICUs or the outpatient clinics. So you'll be, getting acclimatized. So, make sure that, I hope that you can get here on time and, attend that, orientation shadowing that you'll be offered. Similarly, for the electronic medical record system, you'll be given your individual login information. Make sure that you get it. And, that is something that is confidential. So keep that to yourselves. So again, those are the little bit of details that you may get for orientation. This is an important time. This really gets you ready before the ball gets rolling on July 1. So I hope that, that goes by smoothly. Moving on, when you will be joining residency, you'll be part of you're not the one running the show. You're part of a big system. So I want you to be familiar about who your staff really is that you'll be interacting with on a daily basis. Of course, as part of the residency group, you'll be under a lot of supervision. The buck wouldn't stop with you. So right, along with your co-interns, you will have senior residents, the PGY2, PGY3s, 4 and 5s, depending on the specialty that you'll be with, that can really help you, get ready, or basically during your internship as well, to really help you make clinical decisions. Similarly, you'll have chief residents that can serve as junior attendings for you. You'll have attendings, and there are different kind of medical degrees in America, but it's not just medical doctors or MDs. You can also have osteopathic doctors or DOs, and for all intents and purposes, they are almost equivalent. So it doesn't matter if you're attending as a DO or an MD. Both of them have the necessary qualifications to practice medicine independently. So look at that. And also in your co-residents as well, you may see some people with DO qualifications. So again, they may have some additional requirements sometimes to really make sure that they get their appropriate licensure, but their medical qualifications for all intents and purposes are similar. You will also be working with medical students very closely. Now, there's a little bit of a difference in terms of how medical students operate in the US as compared to back in Pakistan. Medical students in the US, they are much more hands-on. You'll be seeing them seeing patients with you. They'll also be doing some kind of documentation with you. So if you have medical students with you on wards, they may offer you to write the progress notes. Make sure that when they share progress notes with you, it's your responsibility as an intern to really go over their notes before you make appropriately edit them and then forward them to your attending for that day. Again, they can be a very good resource. They can really help you in terms of getting your day appropriately going by, but don't just rely on them. Don't rely on just your medical student to give you all the information. The responsibility lies with you as a physician to really look at what is being offered by the medical student, and then subsequently double checking things before you report any clinical findings to your seniors on the ward team. But again, take a moment sometimes to during the day, if you have time, you can teach them accordingly. You can give them a topic to read up and give you 5 to 10 minute talks during rounds, sometimes after rounds. So it's important, and it's a very, very valuable resource that you will have during your residency. And I think it also, for those of you who are interested in teaching, give you an opportunity to make an impact in their careers. You will also see nurse practitioners and physician assistants, which are called APPs, or advanced practice providers, that you may be, seeing as part of, some, not necessarily your own teaching team, but you'll be seeing them, if you are on an internal medicine team, you may see with other hospitalists, you may see them, or you may, see them on other consult services. So these are, medical professionals who have gone through additional training to really allow them to practice independently, and not just, they have more training than a typical nurse, but they are able to prescribe medicines. Of course, they're also under the supervision of an attending, but they are also independent in terms of their clinical decision making. However, they are under the umbrella of some other attending in that regard. You will see, nurses are a very, very important part of your clinical team. They can really be a very close allies. They will give you information. It's going to be very different than many nurses that you may see back home, because they can actually, especially in the ICU, they can teach you a lot. They can tell you when the patient is clinically deteriorating. So always listen to them, always be kind to them, and really include them as part of your clinical care plan, especially when you round with them, round on patients. If you have a certain change in plan, communicate that with your nursing team, and they will really appreciate it when you include them in their in your regular day-to-day clinical activities. You will see case managers and social workers who will help you in terms of disposition planning when you're deciding to send a patient to a nursing home or a subacute rehab, or you're sending them to or they require some kind of equipment. For example, if somebody needs a wheelchair or somebody needs a walker, the case managers can help you, acquire that additional equipment. They will help you with discharge planning, so that you can safely, discharge patients when they're ready to go. Also, social workers can provide patients with very valuable information, especially if they require, other support groups outside of the hospitalization. So it's important to know that they exist and they are valuable resources. You may see medical assistants more so in the outpatient setting, who will be helping you, room patients in and out. Their medical training is less than that of a registered nurse, but again, they have adequate qualifications to really help patients in the outpatient setting. You'll see respiratory therapists both in the hospital, but much more commonly when you're in the intensive care unit. Again, they have a lot of experience when they're helping patients, ventilatory requirements. Also, a lot to learn from them as well, especially in the beginning of your ICU. You'll see physical therapists and occupational therapists in the hospitals, and both in the inpatient setting as well as in the outpatient setting. So again, valuable resources for you to also see how they work in terms of helping your patients, get mobilized in the hospital and to increase, their functional ability. In certain hospital systems, you will see chaplains as well that can provide, religious support, especially, for patients who have a particular faith, and that can also provide them with counseling that is important, especially when there are life threatening diagnosis or life challenging diagnosis that potentially you may come across. And you may see hospice aides as well in patients who are at the end of life. You will see aides and nurses who specialize in hospice care and end of life, quality improvement in the patient's quality of life. So this is a big system. You will learn that there are multiple layers to the care that you provide, but it's not just you. You will see that you're part of a much bigger system when you join a hospital system. So what your average day may look like, I would encourage you to, show up early. When you are joining your hospital ward on July 1, especially if you're starting with a hospital ward or an ICU, once you know that you have the access to EMR, it's important to pre-round on your patients with a chart review. Look at where the patients are assigned to you. By pre-rounding, I mean you look up their vital signs, you look at what medicines they're getting, you look at the previous day's progress notes, if they've already been hospitalized or if they were admitted overnight, look at what the history and physical suggests to see, what is going on with them. Again, don't just have an anchoring bias to see what exactly is written in the notes, so that your plan for the day may just reflect that. Keep an open eye, keep that, take everything that is written in the chart with a grain of salt, because moving on from that day onwards, it's going to be your responsibility as well to have your own, clinical assessment. And when you're sharing that with your senior residents, to that it reflects your thought process as well. But it starts with pre-rounding. It can take you a half an hour, it can take an hour, 2 hours. But I think early on, when you are really joining your intern first day or first month of internship, I think it's better to at least show up about an hour and a half earlier to before your rounds, to come in, see what your patients may have. And then you round on the patients, you see the patients, evaluate them, be courteous, be kind. Again, a lot of detail has been given in the previous, video from APPNA last year as to how to, approach patients, how to approach them in difficult situations. So again, look at all that to really get into the nitty-gritty details. But when you round on them, you make your own notes, And you, if there are any kind of concerning findings that you may see, it's important that you communicate your findings with the senior residents as well, so that if anything needs to be done before rounds, I mean, they have the experience to really see if something needs to be escalated. Then you present your patients on rounds. Your attendings will see the patients with you, and they will help you, make any adjustments in terms of the treatment plans. If any new consult services need to be on board, I mean, they will tell you. And it's important that you put those orders and consult orders in on a very timely fashion. Then, I mean, some services may require you to write notes before your rounds, but many times in the beginning, they have a little bit more flexibility. So I think you're not expected to write your notes even before rounds, but if you do, I think it's good because it will save you time on the rest of the day. But then you write your notes reflecting, I mean, what the findings are reflecting on. I'll have a slide on how to, approach, SOAP-based notes, but you do those notes. And then, if you're required to discharge patients, you discharge those patients after rounds. You admit any new patients if you're on call, and then you follow up on patients that, if somebody had an elevated blood pressure during their, morning, and if you initiated a new medicine, I mean, it's important that you circle back to the patient after your rounds, after that order has been put in, to really follow up what happened afterwards, so your day, as long as you're supposed to be there, you are responsible for your patients. So circle back on your patients periodically to make sure that everything that you ordered is currently being done. And when your shift ends, depending on the structure of your rotations, if you're getting done by 5 p.m., you're required to create like a sign out sheet that you'll be giving to your night float residents to really follow up on things that would require monitoring overnight. So again, this is a pretty, the days can be longer in the beginning, but again, trust me, as you get more and more used to things, you'll get into the flow, and all of us have gotten through this. So again, I'll go over other important attributes that you will be required to survive the day and really thrive as well in the environment. But this is what the average day will look like on hospital wards and also in the intensive care unit. Now, during your residency, you may, while you were actually applying for residency, some of you may have looked at, what the American College of Graduate Medical Education is, and how it accredits residency programs, and they really require the programs to evaluate residents in 6 major core competencies, and and when you get evaluations, you'll be actually be evaluated amongst, I mean, different these 6 specific core competencies, and then subsequent, subdivisions as well. But you'll be looking at patient care. It's important to have, I mean, good quality patient care. When you're really looking at, when you're evaluating patients, you are required to build on your medical knowledge over the course of your residency and training. You are required to really learn the art of medicine as well, and of course, whatever the specialty you may have, surgery as well. It's not just what you've learned over the years from your books. You actually are practicing that and really applying that into day-to-day clinical practice. And you keep doing, self, I mean, evaluations, and you improve yourself along the way. Another very important attribute is interpersonal communication skills. And I think that is something that, as international graduates, I think is a tremendous, thing that we all have to focus on, how to, better become good in terms of our interpersonal skills. It's a different culture over here as compared to back in Pakistan, but the earlier you acclimatize, the better it will be, and have good communication skills. Professionalism is something that's very, very important, and I have a separate slide on that as to how to make sure that you reflect very well when you're doing your day-to-day clinical work. And lastly, systems-based practice, that you are not just by yourself as a singular specialty, you're part of a bigger group. As I discussed, there are multiple other layers to your care. So again, all of those things really make who you are. And that is one of the reasons that almost all residency programs in the US, they're very standardized, because they go through all these core competencies. And by the end of your training, you really end up being a sound clinical professional. So professionalism, it will have so many layers, but I think very much I wanted to just add a few things about how to really demonstrate professionalism during your residency, and especially in your intern year when you're beginning. Unfortunately, in our culture, it's also something that we see quite frequently. When I visit back home in Pakistan, people don't show up on time. Unfortunately, when you're required to really show up at 7 o'clock, people tend to show up at 7:30. Again, it doesn't apply when you're in medicine. You are really, if the attending tells you the rounds are at 8:30, they will be at 8:30. So your responsibility is to make sure that you get everything ready to by around 8:15 or so. So show up ahead of time. I think it's very, very important. And your I think you're reflecting who you are, and actually you're reflecting your background. So make sure that you really put out your best self. And I think it's a habit. And once you get into the habit, I think you will be really doing it over the course of your residency. But I think in the beginning, especially, make sure that you're really showing up ahead of time and getting into this good habit. Have a culture. I mean, try to cultivate honesty and integrity. Unfortunately, sometimes I also see that when you get too comfortable in an environment, sometimes you may really bend your rules. But I think especially in the beginning, make sure that you demonstrate that you are a very honest individual who will really say what they have done. For example, if you haven't asked a question from a patient or really haven't discussed a particular medication that they may have been on, and if your attending asks that from you during rounds, don't say that you asked it and make an answer. Trust me, it is maybe there's a possibility you may not get caught, but I think if you do get caught, it reflects very negatively that you are somebody who is not trustworthy. So never ever compromise on your honesty, never compromise on your integrity. If you don't know the answer, say, I don't know, or I didn't ask that question. Be honest with them. I think nobody is going to really mind that you didn't ask. You are here in a learning environment. But I think what they do really are concerned about is somebody who lies, somebody who's not honest, somebody who really doesn't have solid integrity. So never ever compromise on that. And I think another important thing that probably sometimes gets said in between the lines, but is not really, I see that sometimes, especially in residents from our background, especially if you have other people that are with similar background from you, and your senior may say, oh, it's okay to just, do this and this and this, and you will get by. Never ever buy that. Try to follow the due process. Try to be honest. And, there's a possibility that if you cut corners, you may not get caught, but I think you really are compromising on yourself as a professional, and never ever do things to really get by. Try to, I mean, get the best experience during residency. Try to make sure that you are taking care of patients like you would take care of your own family, and I think things will, I mean, get sorted out. And if you are missing certain details, your attending will not mind that, but well, they will be concerned about is if you're lying about patient care or about other things in your life as well. Avoid gossip trails. It's very easy sometimes when you'll see five residents, someone sitting together, they're bad mouthing one person versus the other person. Trust me, there are moments where the people who you're gossiping may not be, may not have your interest in the best in their mind, and that information may be shared with other people, and they may say that you were talking bad about one person versus the other. So again, try to avoid gossip trails. Another thing that unfortunately is a lot in our culture, but we also see here in the US as well. So try to avoid that. If people ask you what is your opinion about X, Y, and Z, just be honest, and really don't say bad about anybody else, or go into that conversation where you are bad mouthing other people. Build an emotional capital. I think this is a very, very important thing. If somebody when you're part of a team, when you're on the hospital service, you may not be alone. You may have another intern with you, you may have a senior resident with you, and there is a possible time that your colleague or your partner, other intern, may be struggling, and your senior may put an additional admission on your for you, or ask you to do some other things, and you feel that you may be working a little bit harder than your other person, or you may be asked to do a favor or cover a shift for somebody. As long as you're not really violating your duty hours, help other people. Not just help them just because you will be taking a favor out of them, but just help them with the goodness of your heart. And that's what's emotional capital. You be that person who people can look up to when they need help. And I think whatever good you throw in the world, I think will come back at you. So again, have that I mean, have the goodness of the heart, and have the the openness of the heart to help other people, and to really build that capital, that if one day you may need help, in case you do need, I mean, you are the kind of person who's really, I mean, made bridges across you, so that people will help you as well, not with that particular intent, but I think but do good to other people. Be compassionate with patients. If there's a patient who has a particular diagnosis, I mean, never ever share it with people who are involved with their care. No, don't disclose that diagnosis to the patient's family unless explicitly mentioned in the chart that it's okay to discuss their care with other people. Something that's very different in the US culture as compared to the Pakistani culture, but it's important to be respectful of patients' confidentiality, and that is an integral part of your professionalism as a physician. And then in the US, you will have depending on where you're practicing, I mean, you may have a very, very diverse patient population. Here in South Florida, I mean, we see people from South America, from Middle East, etc., etc. So again, you will have very different patient, population. They will have their own cultural values. So, you have to be sensitive. You have to really appropriately, I mean, give care to patients depending on their cultural background. That some of this you will learn along the way, but just be sensitive to them, depending on whatever faith they may have. I mean, don't really, never ever have that cloud your clinical judgment. In today's political world, I mean, you may have an affiliation for one thing versus the other, but never ever have that feeling cloud your judgment when you're taking care of patients. I mean, you're here for residency. You're not here to win a war or to do X, Y, and Z. And, we get, indoctrinated back home about, hate with one thing versus the other. You're not here to, I mean, to wage a war. You're not here. You're just here to get good training and, be sensitive to other people, be sensitive, whatever, um, whatever their sexual orientation may be, whatever their background may be, whatever their faith may be sensitive, be kind to patients. How to have good communication, interpersonal skills, smile often with your colleagues. I mean, when you are saying hello to a patient, have that have that welcoming feel on your face, that you're looking forward to meeting with them. And if they're in pain, or if they're in a lot of strife, for one reason or another, I mean, have empathy with them. Think about what they may be going through, and really provide them with the best care. Communicate effectively with the patients. Try to really cut down the medical lingo when you're trying to explain things to patients. And a lot of time, when you're doing that, you will be under supervision, so your seniors may also be seeing how you're communicating with your residents, and take those cues, whatever they're giving you, appropriately. See how the attending actually talks to the patients in terms of giving them information about their diagnosis, and then practice that in your own in your own interactions as well. Closed loop communication is very important with nurses, social workers, case managers, etc., as well as with other services. Um, Especially in the ICU, or in step down units, when the patients are not very stable, you need to really be very, very quick when the nurse actually tells you that somebody's blood pressure is actually dropping, or their heart rate is rising, or they're having any other kind of arrhythmia on the telemetry strip. Be very, very responsive. Keep your phone or your pagers close to you. And whenever somebody asks for help, I mean, it's very important that you get back to that. Don't just defer that for a later time. Some things are some most of the times, all these information that is being given to you is time sensitive, and they're documenting that the doctor X, Y, and Z was updated about a new onset, I mean, PVCs in a particular patient, or hypotension in a particular patient. So again, maintain that communication very closely. And then if you don't know something, or how to approach a particular new finding, you will always have this layer of protection above you. Talk to your senior residents, especially in the beginning, when you don't know which thing is more important. Is discharging a patient is more important, or admitting a new patient is more important, or putting in a consult or a particular order. Your senior residents will really help you along the way. So it's really important to include them, and you will learn, I mean, how to get more and more efficient along the way. But on July 1, you'll not be expecting to really take care of 10 patients and discharging patients. You'll have always had this layer of protection, and this will be with you through the whole year. But as the year goes along, you will be needing them less and less. Medical knowledge, you're not expected to be experts in internal medicine, or general surgery, or psychiatry, or pediatrics the day you walk in. I mean, you will be expected to learn. But again, it's very important to use your day wisely. If you've planned your day well, you will have those mini breaks in the day. You will get those 15 minutes, 20 minutes here and there, that there will be no new pages, no new, I mean, admissions or discharges to do. And it's those minutes along the way will really add up. So I think use that time wisely, and you read up on your patients, and you can have access. Most of the programs or medical records will actually have up-to-date installed in them, and they will also, programs will give you resources like MixApp for internal medicine. You will have other resources for other specialties. So look at those, if you get time during the day, to really keep learning along the way. You will also have didactics that are going to be built in your day, especially if you're, regardless of whatever, rotation you're on, but especially when you're on electives. I mean, you will have, um, some MCQ sessions. You will have some, morning reports when you're on the hospital service. You'll have grand rounds. So I think engage on them, attend them, try to really, if you have any questions in those conferences, make sure that you ask them. Don't be shy. And if you're asked to give a talk, maybe later in the year, I mean, don't be shy to really, stay away from that. I think it's important that you learn the art of, giving, talks, and you will learn along the way. You'll realize the talk that you gave, or the little presentation that you gave, it really allows you to become the expert in that topic, and it really allows you to, showcase your leadership as well. So again, don't shy away if you're if you're given the opportunity to present on the topic. Also, in today's day and age, you'll have social media platforms. You have Facebook, you have LinkedIn, you have X. So, use that wisely. You'll have, especially if you have aspirations to apply for fellowships, or you're in, or like academia, you can actually connect with a lot of people on X and LinkedIn as well. And you can collaborate with them. In gastroenterology, for example, there is a lot of groups on X, for example, that really allow you the opportunity to engage with other residents, engage with other fellows and attendings, and they allow you to also participate in research. So again, if you have that interest with you, I think you can use social media to your advantage as well. Again, try to stay away from divisive topics. Try to stay away from politics if possible. you know uh, Nothing good comes out of putting out a controversial statement. You're really not gonna make a big impact in the world, trust me. But I think if you really try to engage into divisive topics, I think you will end up in trouble more often than you think you may. So, just a little snippet on note writing, and you'll be required to document throughout the rest of your life, whatever specialty you may choose. But, when you're taking care of patients, you will have this SOAP note structure that I wanted to just briefly mention. That SOAP or SOAP, goes for subjective, O is objective, A is assessment and plan. As physicians, I think the thing that probably will get more and more mature as you go along the year is your assessment, because I think if you have a solid assessment, it really reflects that you are really thinking clearly about what's going on with the patient. But starting with the subjective, especially when you're doing the HNP or the history and physical, you describe what the patient came in with, what their background information. Somebody's coming in with chest pain, you're describing the character of the pain, you're describing, the onset, you're describing what the circumstances were when the patient started experiencing all this. And then you create a story out of that and really describe all the pertinent information. And then you describe the review of systems. And many times, you will have this integrated as part of your electronic health record, and it will have like a template with you that's going to be very easy, especially with review of system, to click through and through. Be very conscientious of that. Don't just go through everything without even reading what are you clicking or not. It's at the end of the day, whatever you write and put it in the medical record, it can be can have medical legal consequences as well. So again, think about what you're doing and make sure that you document everything appropriately. Look at the medicines, look at their allergies. Then you go toward the objective, which really starts off with the vital signs. What does the patient look like? Describe the vital signs, the physical exam findings that you did, and be honest about that. And then subsequently comes the lab data, then the imaging that you may be seeing, and again, document if you independently reviewed something or took the help from another specialist regarding that. And then ultimately comes your assessment, which is like a few lines of what the patient has. For example, if it's a 60-year-old patient with high blood pressure or hypertension, diabetes, dyslipidemia, coming into the hospital with new onset chest discomfort radiating to the left shoulder, and with the presence of these vital signs, and elevated JVD, and an S3 gallop, and when you did the ECG, there was evidence of STT changes with the positive troponin. So based on this clinical presentation, the likely etiology appears to be some kind of acute coronary syndrome with this and this. So this is your assessment. And if there are particular differentials, or you're not really clear about the diagnosis, you mention that those differentials as well. And then ultimately is your plan, which is usually problem based. You prioritize what the number one issue is with the patient, and then you describe what are you going to do about them, and then you go through each and every problem that the patient has, and you document that. And then you share that with your attending, who will go over your note. And sometimes, and especially in the beginning, they will give you some feedback how to structure your notes in a particular way. But I think you will get the hang of it soon. But I think this is something that's very, very important. And whoever is going to be seeing patient, this is note writing is going to be with you for the rest of your career. So the earlier you get used to it, the better it is. And especially if you're already in practicing medicine, either as a resident back home in Pakistan or some other specialty, try to practice that from the beginning. I think it will help you, get used to things. Documentation, apart from the note writing that I described, should also not, you're required to document, either a progress note or an HNP on every day. However, if anything changes, for example, your patient, suddenly decompensated and, had respiratory failure, had to be intubated, had to be transferred to the intensive care unit. It's important that once you take care of the patient, you document what happened, because that really is an important thing for other clinical care providers who are taking care of the patient, as you know, that you were called in by the nurse at this particular time, and you really found the patient to have these clinical findings, and you actually subsequently, communicated that with the intensive care unit. The rapid response was called, or a code was called, and these particular steps were taken, and the patient subsequently responded or did not respond, or whatever happened. So this doesn't have to follow that SOAP pattern. This is just a change in clinical status. But again, things need to be documented. Don't assume that other people will document. As an intern, as a resident or as an intern, I think you'll be expected to do that documentation. And especially, other things that may change, the patient expresses a will to really do not be resuscitated, or has other important, describes another important things, that they don't want to receive a particular medication because of this concern, or they don't want to receive blood transfusions. Also document that as brief, change in status notes for the change in status notes for the patient in their record. Again, if you called a consult to a particular specialty and they really, made any important changes to your plan, put like a little comment as well, or a new small note as a change, as a snippet in there, that they, based on these recommendations, these changes were made, or any new things were added to the patient's regimen. So again, learn the art of, adequate documentation for your patients. Then coming towards, as part of your training, you're expected to receive feedback. Some of it is formative, that is given to you on the daily basis. Some of it is summative, that, your program or your mentor will sit down with you every few months and go over all the evaluation or things that have been recommended to you to basically help improve things. So when you're going for an evaluation, or an attending says, okay, let's just talk about how the day went, before they even say that, have this whole habit, or have your own habit of really performing a self-assessment. Think about how the day went, things that could have been improved, things that actually went well, and how you want to keep doing that moving forward. And have that mindset that yes, you are there to improve. You want to make sure that you become the best version of yourself, that you become the best physician possible. So have that growth mindset, that you are not just there to get past this day. You want to be in the system because you want to become a better professional. And sometimes the attendings may ask you to do that, but many times I also encourage my own residents to have this amongst themselves, that before a rotation starts, think about things that you want to improve. For example, if you're going into an ICU rotation and you think that you want to become better at one particular procedure, or you want to be able to manage conditions more proactively, write down things that you want to improve, and then continuously work on it, and really share that with your attending, so they can help you achieve that goal for you. Sometimes you will get negative feedback. The attendings will tell you that you things that you could have done differently. Sometimes culturally you may get feedback different from different people. But the last thing that I want you to do is to become defensive, or really explain in great detail why you did X, Y, and Z. If somebody's telling you that you could have done something different, listen to them. Thank them for the feedback. Thank them for really, taking the time to actually explain things to you. Sometimes you may not understand what they're talking about, and it's okay to ask them specifically, okay, can you just elaborate about what you thought happened, or maybe the details that you thought were different for you as compared to them, without sounding defensive. And then once you get the feedback, if you know that you did something that you could have improved, and embrace it, and think and tell them that yes, you'll continue to work on it, and maybe we can talk again after a few days to really see how you have inculcated their feedback into their clinical practice. But take time to reflect. Don't think that this is a negative thing. All of us have gotten feedback to make ourselves better. This is where, this is why this medical education system is one of the best in the world, is because of, everybody's invested in your growth. And, if you feel sometimes, the feedback may actually be unfair, which is, not very common, but again, can happen. And if you feel like, you keep getting one particular kind of feedback over and over, and you just don't know, how you can improve yourself, or how you can, take that feedback. You can, if you have mentors that may be in the same field, or maybe in another specialty, it's important to review that feedback with them, so that they can actually, give you, or basically give you guidance about how to approach that situation. But again, it's important that you take that feedback positively, and you continue to improve yourself. when you're asked to give feedback, or this is the thing that we usually see as, people who are giving feedback, many times it's important to really give the feedback in a specific, timely fashion. You need to specifically describe what the trainee needs to do. Specifically, if they're seeing a particular patient, maybe they're not really clearly asking questions or really describing the scenario to you. So maybe their presentation skills may be at fault, or the way that they are approaching, patients in a timely fashion. And so again, it's important to really tell the trainee, and when you are really giving feedback to a medical student, tell them specific things, tell them things on a timely fashion. Don't delay feedback, until 2 to 3 months later on. I mean, give them a plan about how they can improve themselves. And that's what I try to do that as well. And to try to really give, the trainee or a medical student, a plan as to how they can actually improve whatever the skill they may be required to improve. And then have reasonable expectations. Try to observe, the feedback that you get. And subsequently, especially if it's a skill is in the ICU or in any other procedural specialty, try to really make it very simple as to really describe, the mechanics of that particular thing, or really the activities of behavior for that skill, and not just personality characteristics. So during your internship and residency, you'll have, attendings, but there'll be, you may be assigned a mentor. But if you have a particular specialty interest, say if you want to do, if you are in internal medicine and you want to do, say, cardiology or pulmonary critical care, it's important to actually seek mentorship in that specialty group. Or, you'll find, a supporter for you, or really somebody that you connect with, even in the internal medicine staff, and really seek mentorship as to how to, get better, how to really, you may ask them advice about, how to approach your day, how to really make yourself, even more time efficient. They can guide you, they can support you, they can help you. So really, it all depends on you. I would not recommend to have many mentors. Maybe have one or two people that you can confide your all the information that you're providing to them, and really, listen to them when they give you ideas to help improve yourself. But again, mentorship is something that's very, very important. you know and you'll realize that once you start residency, you will start to realize, your day is going by so fast, you may not be even have time to process everything. But, once in a while, maybe once every week or 2 weeks, have a time where you can, debrief yourself about how far you've come. Sometimes appreciate the journey that you're taking, and really see, that you've really learned how you really become a better physician, and you've had personal and professional growth along the way. And, look at the big picture about how this journey is affecting you, where it is taking in your life, and what are your plans moving forward. So don't miss the forest for the trees. Don't get so absorbed in one particular day that you miss the whole purpose of this whole training experience for yourself. And while you do that, it's important to, don't get to avoid burnout. And this is something that we see quite frequently, even when you finish your training. This is something that will stay with you. So have those, strategies with which you can actually have resilience moving forward. So use the most important thing, I think, so is going to be using your time off wisely. In your beginning of your intern year, and along the intern year itself, you may not have 2 weekends or the both of the days in the weekend off. You may just get one day off. So use that time wisely. Don't put everything that you need to do on a Saturday, on a Sunday, that, all that time is just spent on, doing chores. Plan your vacations well in advance. Many times, even at this stage, I think 2 months into your residency, 2 months prior to your residency, your chief residents or your attendings may actually reach out to you. When do you plan to take your vacations? So again, think about that. Talk to your families, talk to your support systems to what is the best time to take time off. If you want to spend Eid with your family, how's that going to look like? Look at how much time you're going to get off. So again, plan things in advance, especially, many programs may not allow you to spend more than 2 weeks off. So again, especially if you want to travel back home to Pakistan, plan those vacations very in a very timely fashion. Avoid procrastination. If you want to do something, make a solid, plan for it, write things down. Have a to-do list that you need to do, and revisit that periodically, so things don't get fallen behind when you're going into your daily motions in your training. Engage with family and friends. Talk to your parents, talk to your friends periodically, just to, relax yourself. Have, have their local support systems as well. If you're a religious person, what is going on in your local community, things that you can do on your day off that can help, take the stress out of you. There are also resources in the hospital. Sometimes there could be gyms, sometimes there could be other, you know areas for relaxation. So if you have a few mini breaks in the day, or you have some time, I mean, you can try to de-stress during the day as well over there. If you feel like you're getting burnt out, there are always support systems, more so now than ever, I think. So when I did my residency close to 7, 8 years ago, when I graduated, I think as compared to now, I mean, we have a lot more resources for our residents to really, help them avoid burnout, build resilient strategies. So ask for help, ask your program director if you feel like you're getting too burnt out. I mean, talk to them about what can we do to help you build resilience. Exercise often, it's easier said than done, I must say. But again, if you properly exercise, I mean, it would really help you, have resilience during the course of a very busy day, to have the energy to keep going and to avoid, getting completely physically exhausted. And eat right. Something again that, especially for those of you who may be leaving home for the first time, if you eat foods that will just, I mean, curb you. I mean, it will just be for cravings, etc. Again, it can give you sugar rushes, and it can crash you during the course of the day. So eat right. Hydrate yourselves appropriately. And the diet here is very different compared to back home in Pakistan. So again, try to have a balanced diet. Try to keep yourself hydrated. Whatever you may need, tea or coffee during the course of the day, do that along the course of the day, so that you can have good performance, and good sleep as well, in a 24-hour period. And at the end, I think I must leave you with this. I think try to just be kind. I think this is a very, very special time in your life. Be a reflection of what you'd like to receive, because I think what you love, I mean, and this, I mean, you're here as physicians. You have really done very hard, worked very hard to come to this point. And I think it's your responsibility now, that if somebody's asking help from you, it's important that you also, reciprocate that. I mean, people the opportunity, or give them exposure if they're asking you for some. If you really are helping other people around, I think that help will ultimately come back to you. So the world it's a very funny place, but I think I do think that it does follow a particular pattern. And I think the more thankful you are, the more gratitude you have, and the more help that you provide to people around you, at the end of the day, all that help is going to come back to you. So with that, this finishes my take on intern year. I think it's a very special time in your life. I would highly encourage you again to watch the other 2023 video, to go over other important aspects of your intern year and training. And I'll see you guys again soon with other esteemed panelists to go over any questions that you guys may have. So congratulations, and I'll see you guys soon.